day to you all. My name is Dr. Eben Aje. I'm a clinical oncologist with the NSIA-LUTH Cancer Center. Today we'll be having a short discussion on colorectal cancer. Now let's just take a dip at what we call the symptomatology. How will it manifest? Now early colorectal cancer disease are usually very quiet. They really do not have any clinical manifestation. These are the ones that are picked during routine medical examination. However, the ones that produce clinical symptoms are those ones that are the invasive part of the disease or in metastatic part of the disease, which are this. The prominent one that I must mention first is bleeding parectum. When somebody begins to bleed in stool, either with the stool or bleeding alone unprovoked, you should have yourself checked out. Now, change in bowel habits, constipation alternating with diarrhea is another major factor or another major symptom that you must look out for in having to picking colorectal cancers. Then unintentional weight loss. Person just discovers that he's losing weight without any deliberate program to cut down weight. These are part of the symptoms. Then you could have abdominal distension, abdominal swelling, vomiting, feeling of unwellness. You go for a medical check and they tell you that your blood level is low, because you could also have bleeding that is not visible, to the naked eye, and you could have cough, you could have yellowness of the eye, low back pain, and inability to walk. Now the last three symptoms are symptoms that are associated with advanced disease that has spread to other organs. Now, how do we treat? The first treatment method I'm going to talk about is prevention. We need to prevent it. By way of prevention, you look at the risk factors we have mentioned earlier, and you make sure you're not towing on the path of the risk factors. Then the second way of treating is screening. You must go for screening, at least yearly screening to check your numbers. However, there is a probe that can be passed in through your anus to have your guts, to have the rectum and the colon checked. That can be done 5 yearly or 10 yearly, as the case may be. They will pick up lesions in their earliest states, and they can be nipped, they can be biopsied, and you can know whether there is a pre-malignant stage of the disease that is coming up or not. Basically, there are three ways with which we treat. The first one is the surgical method of treatment. This involves cutting out that segment of the colon or the rectum, as the case may be, that has been affected with the disease. The second way in which we treat is by chemoradiotherapy. Radiotherapy is a treatment modality in which ionizing radiation is targeted at that site, and it shrinks and it dries up the tumor, and of course aided with chemotherapy. The third way of treatment is systemic chemotherapy with targeted therapy, which is available in the center where I work, in the NSIA-LUTH Center. There's also a role for radiotherapy in palliative cases, where you could radiate the brain, or you could radiate the spine, or you could radiate a particular organ of a bone that has an affectation. I hope that with these few issues that we've been able to raise in this short discourse, you've learned one or two things extra to what we know about colorectal cancer. Thank you.